evening, everyone. I'm Donna Bush with your CIG TV News Update. We begin with highlights of our Thursday morning press briefing announcing the recommendations in the Minimum Wage Advisory Committee's report.
While the general public has indicated clear support for the establishment of a minimum wage, it would seem that based on public feedback and opinions provided to the committee during the process, that the public is, however, thinking in terms of a living wage as opposed to a minimum wage. And there is a distinct difference between the two. A minimum wage, as defined by the International Labour Organization, is a sum payable to a worker for work performed or services rendered within a given period or collective agreement, which is governed by law and which may be fixed in such a way as to cover the minimum needs of the worker and his or her family in the light of national, economic, and social conditions. A living wage, on the other hand, is based on the basic cost of living in a country or area in a country and is not enforceable by law, and there is no universally accepted definition of a living wage or agreement on how to calculate it. Out of the 2,097 respondents to the field surveys, 80.2% identified cost of living as the most important factor in determining a minimum wage, and age was identified as the least important factor, with only 10.2% indicating it was most important. Based on the importance of the cost of living placed by those who participated in the public consultation, it is anticipated that some persons will not be satisfied with the committee's recommended figure. And going off script, I can say that this, of course, is their democratic right. While the Minimum Wage Advisory Committee wants to ensure that all people in the islands have a decent standard of living, the committee did not focus on a living wage, but followed the terms of reference for the project, which was to identify a minimum wage that would fulfill one of the objectives of the exercise, which was to address exploitation and provide real relief to the lowest paid workers.
And you can watch Thursday morning's press briefing with the Ministry of Labor, the chairman of the Minimum Wage Advisory Committee, and the Premier as they talk about the results of the committee's report, only here on CIG TV tonight at 8 o'clock. Dr. Carl Brown Jr. has joined the Cayman Islands Health Services with a specialty in anesthesia and intensive care after returning home from medical school. Dr. Brown studied at the University of the West Indies and had 5 years of hands-on experience during summer vacations here at home. Dr. Brown says it gives him great pride to be working with the HSA, and he looks forward to playing an active role in the further development of the Department of Anesthesia and Intensive Care and the development of our health services as a whole. He joins a team of 75 full-time physicians at the HSA, 61% of them being Caymanian. HSA Medical Director Dr. Delroy Jefferson says he is grateful to have Dr. Brown return home to join the HSA team. Well, the Mosquito Research Control Unit, along with the local public health officials, monitored and fought the Aedes aegypti mosquito that carries dengue fever and chikungunya. Residents may have seen mosquito planes and fogging machines in various areas across Grand Cayman when cases of infection were reported and confirmed last year, June. Mr. Bill Petrie, director of the MRCU, says they were aware of the threat of chikungunya and had done work prior to determine if they could fight it. That planning is what allowed the Cayman Islands to have very low levels of the illness compared to other countries in the region. He says they did a number of things to combat the illness.
That we already had, and indeed have, a program in place to control the mosquito that transmits chikungunya, because it's the same mosquito that transmits dengue. So we had an advantage in that we already had a program in place. In addition, we were aware of the threat of chikungunya from information we'd received previously. So we were able to make a plan of action as to be prepared.
And join us tomorrow when we bring you a full report with Dr. Petrie, Chief Officer Jennifer Ahern, and Dr. Kiran Kumar of Public Health. And if you missed our news update, you can get all the details on our Facebook page and YouTube channel. Also, don't forget to tune into Radio Cayman's talk shows, For the Record and Talk Today. That's weekdays and week mornings. For now, I'm Donna Bush, as always, wishing you a wonderful and safe night and inviting you to join me again here on CIG TV's News Update on Friday evening. Until then, bye-bye for now.